Hello, it's Bill, the Knee Pain Guru. We are doing our first live stream, knee pain Q&A. So, welcome to my channel. Welcome to the to this live stream. And if you have questions, please type them in the chat box over here on the right or on your right. Leave your questions about your knee pain and or the situation with your knees over to in the chat box. Okay. So leave your questions there. Until I start getting questions, I am actually going through YouTube comments that were left on my channel that I can answer those. So let me get over here. This is from Christopher. It says, I had 2 knee surgeries to address 2 knee dislocations, one from the right knee and one from the left knee. I'm a collegiate wrestler for ASU and a mixed martial artist fighter. My biggest flaw is the instability and weakness in my knees. Please advise would be needed. Okay. Advice. Okay, he's looking for advice. Well, I don't really give advice, but I can give you a direction. This is all about strategies. Strategies based on creating comfort in the knee. Most of your approaches, medical doctors, physical therapists, are going to be looking at how can we get the knee mechanically sound. And just because the knee is mechanically sound doesn't mean, it's lined up and it looks okay on an X-ray, a CT scan, or an MRI, doesn't mean it's going to function properly. And from my approach, what we're looking at is when the body is comfortable, we have a good solid foundation to move forward with. So when the knee is dislocating, something is not lined up correctly. Something is pulling too tight. Something else is not pulling tight enough. And when the body tries to engage itself, the legs try to work, the hips, the lower back, you're running, you're wrestling, you're fighting martial arts, you have an imbalance going on. And what ends up happening is the knees, apparently, are the weakest link in the series of tension from the head to the feet. So it dislocates. It happens that way because there isn't that balance that's taking place. And from a conventional approach, we're going to take that imbalance and we're going to strengthen it. All good intentioned. However, what ends up happening is you just create more of an imbalance. You create a stronger dysfunction that is going on in the knee, in the leg, in the body. And when we do that, it makes the knee more vulnerable to that imbalance, the dislocation and things like that. So what we need to do, think of it like we need to raise the bridge and lower the river at the same time. So we need to first relax what's tight. And then this is going to be more comfortable once we relax what's tight first. Then we strengthen what's loose. Does that make sense? If we strengthen what's tight, or if we strengthen what's loose first, then what ends up happening is we create a further dysfunction, a stronger dysfunction. Okay. David, thank you, David, for sharing your question. And that's what this is for. Ask your questions. We can give you strategies based on comfort. Kind of dispel the myths of what's going on in terms of dealing with your knees. Okay, David says, I'm currently recovering from meniscus repair surgery, no weight on leg for 6 weeks. Now I'm having trouble getting full movement 3 weeks into PT. Doing I think you forgot an A, MUA in 4 weeks. And if I can't lock out the knee. Okay, what David's talking about is manipulation under anesthesia. And David, that is usually what happens. Is there is the belief that if we break down the scar tissue, that will increase the range of motion in the leg. Unfortunately, it doesn't work that way, because what happens is the scar tissue is forming as a result of the threat that the body is feeling, the knee is feeling, the leg is feeling as a result of the trauma that it's been through. So you had a meniscus repair, which meant you had a trauma before you had the meniscus repair. You had an injury to begin with, trauma. Then you have the surgery, another trauma. Even though it's there to help, what ends up happening is the body tenses up to protect itself. Natural, normal response to trauma, accidents, injuries, whatever the case may be. So what ends up happening is when the body tenses up, that's where the scar tissue forms, is in the space around that tension to hold the knee joint in a place so it doesn't get injured further. It doesn't experience more pain. Unfortunately, what happens is if we're pushing through the pain, which is what physical therapy does, push through the pain to break down the scar tissue, what happens? The body tenses up more because it's another trauma it's going through, more pain. You aren't going to push through pain to get out of pain. It just doesn't work. You don't need letters after your name to figure this one out. This is a common sense logic thing that you will not get out of pain. If you truly want to increase range of motion and reduce the pain in your knee, pushing through the pain will not get you out of pain. What we need to do is go back and create comfort in the knee. First of all, in the knee. And what happens when we create comfort in the knee is the joint relaxes. When the joint relaxes, the range of motion increases immediately. When we increase the range of motion, your natural movement in the knee joint begins to break down the scar tissue. Then we create more comfort. We begin to change the neurological signaling that's going on in the knee and how it relates to the rest of the body and the brain to relax the tension in the joint, increase the range of motion, and just your natural movement will begin breaking down the scar tissue. Now, does it mean it's going to be completely out of pain? When I talk about comfort, comfort is relative, meaning if you're in a pain level of a 7 and we get the pain level to a 5, so your knee can move at a greater range of motion, great. And David's saying only discomfort, but it's all an expression of your nervous system. Your nervous system expresses it differently. David, someone else may feel it as tightness. Someone else may feel it as tension, achiness, shooting, burning, pain, discomfort. Everyone has a different way they describe what's going on in their knee. David's describing it as discomfort. None of them are wrong. It's all an expression of your nervous system, how the body tenses up to deal with the trauma. Okay, hi, Bill. Fergus asks, hi, Bill, how does one know they have meniscus or osteoarthritis in a knee quick test? Is floating in deep end of pool a good way to repair meniscus if damaged? Fergus, and this is the difference in the way I look at knees. Yeah, I don't know, like an answer to your question, because I look at knee pain through a different lens. Would you care? Would you care? Answer this question. Would you care if you had meniscus damage or osteoarthritis if your knee wasn't in pain? if you didn't have any problems in your knee? 99 out of 100 people would say, no, I don't care, because the pain isn't there. The only reason you go to the doctor, the only reason you go to the physical therapist, the only reason you ask a professional with letters after their name is because you have pain. And if the pain isn't there, if we create comfort in the knee joint and get the knee out of pain so you live in your life the way you want, you have flexibility and mobility in your knee, you could strengthen your legs, then we use the diagnosis to understand what we're dealing with. Because if something is broken or torn, it's different than if nothing is broken or torn. But ultimately, it's the pain that we want to address. And if we get the pressure off of the nerves, shift the neurological state, the pain goes away, we're having a different conversation. You're doing the things you want to do in your life. And you're not you're not showing up on the Knee Pain Guru's YouTube channel to figure out what's going on with your knee, because the knee's not in pain. That's the only reason you're here. So we get you out of pain, you go live your life. Welcome, everybody. If you have questions, type them in over in the chat box. We are working on strategies and approaches to relieve knee pain, whatever you have going on. And David, did I answer your question? The big thing, if anybody from here, you're like, well, what do I do next? Head over to my website, take the 7-day knee pain reduction challenge. I have a specific stretch there that is designed to help teach you how to create comfort in your knee joint, get the pressure off of the nerves, notice the neurological change that happens as a result of introducing comfort to the knee, and then we can go from there. And if it doesn't work for you, great. No harm, no foul. You go your way. I'll still be here helping people through the lens of comfort. That's the big difference. Comfort, if we focus on comfort, comfort will lead us out of pain. But if we're trying to push through the pain, what we focus on expands. We're going to create more pain by focusing on pain. It's kind of like it's a real simple concept. And that's where a lot of people overlook this program, is because it's simple. But yet, if simple works, why make it complicated? Unless your life is way too simple and you like making things complicated. I have stretches, just wanted to hear that MUA is not really necessary. David, I challenge you on the stretches. The stretches that you're doing are actually increasing the tension in the body, because you stretch and it feels good for a little bit of time, but it comes back afterwards. If it comes back afterwards, you're not changing the neurological patterning that is causing it to be tight to begin with. So the manipulation under anesthesia is going to be necessary if you don't do things differently. Is that making sense? Like, it's like, if you eat a lot of food, you're going to gain weight. And if you continue eating lots of food, you're not going to lose weight. You have to eat different foods and different amounts of different foods in order to get a different result. So, okay, we got more questions. Susie says, partial knee replacement, surgery, or use your recommendation. Partial knee. Susie, you can work, like people with knee replacements work with my program a lot. The challenge is, and I dissuade people who've had knee replacements from using my program, and I'll tell you why. Because there's a tendency, once a person has gone down that path, there are a lot more complications to getting out of pain. It's not that it won't work. It's more of a mindset piece that I'm coming from such a different approach. People with knee replacements are looking for a quick fix. They're looking for their knee to be out of pain yesterday. And I get it. I understand. But there's been a lot of trauma that goes into a knee that has been replaced for probably years before the actual trauma of the knee replacement surgery that's taken place. And when that happens, there's a lot of mindset and belief of going down that path that makes it difficult for them to suddenly shift and go, oh, we're going to create comfort in the knee. Like, what is this guy talking about? However, when we focus on comfort, we're actually lining up with the innate healing capacity the body has. We're lining up with the ability of the body to heal itself, as opposed to going against it and creating pain. It doesn't get you closer to where you want to be out of pain if we continue to create pain. So, oh, wait a minute, partial knee replacement surgery or use your recommendation. Susie, I read that question wrong, but head over to my website, try the 7-day challenge. Work with the rotation stretch, see how it works for you. See if you notice the change, and, you know, wink, wink, nudge, nudge. When you create comfort, when you do anything to the body, there is always a change that takes place. It's whether you choose. Now, this is a choice to look at the change that has taken place as a result of comfort. So it's a mindset shift. It's a very different direction in terms of how we're approaching the body and how the body is able to heal itself. Okay. David, did I answer your question? Fergus, are we good? Susie, let me know if I answered your questions on there. It's exactly how I feel. I don't want the surgery. Thank you. God bless your work. Thank you, Susie. Yeah, I appreciate it. You know, it's like the 7-day challenge is there to help, to give you a ladder. It's like, hey, you got knee pain. Try a little bit of this. If it works, I got way more back there. This is exactly how I work with clients not exactly, how I work with clients in my different programs. We talk like this. I see what's going on. If we need to have a mindset shift or adjustment to get more benefit out of the program, then we do that. And if not, then you continue on. And the whole goal is to create comfort and let your body reorganize around that. Create more comfort based on that feedback, and your body reorganizes around it. And it's a perpetual evolution of understanding and your body adjusting to experiencing comfort on a consistent and regular basis. And then it creates a whole new reality for your knee and your body and your life. If you like this information, give the video a thumbs up, like and subscribe to my channel, turn on the notifications so you know when I'm going live. If you have more questions, second opinion provider suggested stem cell injections wasn't for me. Okay, stem cell injections, yeah, I don't like needles either. The deal with stem cells, and I believe they're very beneficial, there's a couple of layers to this. If you're usually they want to inject stem cells in a joint that has lost the space in it. And if you're injecting stem cells in a place that's already wearing and rubbing because of a dysfunctional neurological pattern that's going on in the knee, you're kind of throwing away good money after bad. So if we lead with comfort and we relax the joint creates space, and you don't have pain. If you still want the stem cell injection, that's great, and that's going to give you more benefit because there's now more space in the joint for the stem cells to take hold. Now, if we look at your body produces stem cells all the time, and if it doesn't have enough stem cells because the allocation of stem cells is going to heal the inflammation systemically in your body, then if we change your diet, your body frees up the allocation of stem cells and now can go to your knees because it isn't a high priority for your joints to be saved. That's kind of how the body works, if you look at it from a holistic or systemic perspective. Okay, let's see. Yeah, I don't blame you on stem cells. I don't like needles either. Okay, Hans, let's see. Had a partial knee replacement 7 weeks ago. I had started a yoga again. Can I Hans, I'm not understanding. Can I course? Oh, cause harm. Cause harm. If I'm working the lotus position, that would be a question for your doctor. And it's also like, if you're causing pain, pain is usually an indication. Pain is usually an indication that something's going wrong. And if we don't have pain, well, guess what? The body's doing pretty good. That's what the nervous system is there for, which leads to another conversation around pain management, and that where they actually numb the pain or sever the nerve in the body so you don't feel the pain, so you don't know if you're doing something wrong or not. I don't know. Doesn't sound normal to me. Hans, does that answer your question there? Oh, let me, you know what I'll do here is I will give you the link for the 7-day challenge. It should be in the, it should be in the, head over to the website, and it had the 7-day knee pain reduction challenges at that link. So it's good stuff. I'm going to be retooling it here shortly. Let's see. No more questions. Okay. I'm going to wrap it up here. Thanks to everybody who asked questions, who participated. This was a good first one. Awesome. Once again, give the video a thumbs up if you liked it. Like and subscribe to my channel. Turn on the notifications so you know that I'm going live. Share it with your friends. I'm going to jump off of here. I have one of my group programs. For those that don't know, I work with clients in a group context. It's in a private Facebook group, and they have access to videos in the members area of my website where I show them specifically which videos to work with based on what the challenges that they're having. If the pain is standing, if the pain is going upstairs or downstairs, or range of motion in the knee or in the kneecap or the back of the knee, I give them the specific videos to do for homework. Then they report in based on what I gave them for homework to do. They give me that feedback, and then we continue forward and get them more and more out of pain. Let's see. God, do we have more questions here? Thanks, Susie. Yes, a lot of stuff there. This is new for 2019. Bill has been kind of behind the scenes working on some structural stuff with the business to make sure it's there exactly how it reflects me better. So, sports physiotherapy. Hey, all right. Awesome. Thanks for the thumbs up. And I do want to end on this. I am not like anti-doctor, anti-physical therapist, or physiotherapist. I think they all have their place and can support your process. We need to understand a broader perspective to know what we need to pull into the equation to get you out of pain. For me, I dislocated my left knee 4 times, had ACL reconstruction in my left knee. I had 2 pieces of meniscus removed. I wouldn't have been able to get to the place where I am now without the surgery. So I needed that Western medical approach to help me. Now, beyond that, I'll be like, and the doctor, Dr. Ellis, University of Louisville sports doctor, was like, okay, this is what we're able to help you with. On the other side of that, he had no answers. On the other side, when physical therapy ended, he had no answers. The stiffness, the achiness, why just the scar sweat? He didn't have answers for that because it's outside of their knowledge and understanding. Let's see, how can I put this? There's more to us than just skin and bone and fascia and muscle and lymph. There's more to us, to it. There is a neurological component, the nervous system response to pain. And if we don't take that into consideration, we're leaving so much on the table. The emotions, our mindset, our diet, supplementation, breathing affects tension in the nervous system. It all goes together. And the medical model is very good if something is broken or torn. But if what has been broken or torn has been repaired, or there was nothing broken or torn and you're still having pain, that leaves this huge realm, a burden of responsibility on that model that doesn't know how to address it. So they develop pain management. Well, if we numb it or cut the nerve so you can't feel it, well, then it's fixed. We did our job. But there's a whole realm of stuff that's not being addressed there. And that's what this is for. That's where what I bring to the table, or what I've studied for the past, 98, December 98. So it's 20 years. 20 years this year. December of 98, I dislocated my left 4 times. And now 20 years ago today, I was walking around with a partially torn ACL and then dislocated my left knee a few more times. Okay, I got to scoot because I got to be on my group coaching call here in a few minutes. Thank you so much for being here. Thank you for your support. Like and subscribe to the channel. Give it a thumbs up to the video. Share it with your friends. Turn on the notifications. Go over and take my 7-day knee pain reduction challenge. And we'll be doing more of these. Thank you so much. I'll talk to everybody soon. Bye.